Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Stand up tall for a moment, relax your jaw, drop your shoulders. Now ask yourself, why does the neck hurt so often, even when nothing dramatic happened? How can a small nutrient, measured in nanograms per milliliter, influence pain in a structure as complex as the cervical spine? Today, focus on one clear idea. Vitamin D may help neck pain most when the pain is connected to deficiency, muscle dysfunction, bone stress, inflammation, poor recovery, or reduced rehabilitation response. Do not treat it as magic. Treat it as biology. Neck pain is not only a neck problem. Think wider. Think muscle endurance. Think nerve sensitivity. Think posture control. Think bone metabolism. Think inflammation. Think sleep, sunlight, age, skin exposure, diet, body weight, medications, and indoor life. The neck is a small region carrying a heavy neurological and mechanical responsibility. It holds the head, protects the spinal cord, coordinates eye movement with balance, and responds to stress within seconds. Now ask, why would vitamin D matter here? Because vitamin D is not merely a bone vitamin. It behaves like a hormone-like regulator. It participates in calcium and phosphate balance, interacts with muscle tissue, influences immune signaling, and may affect pain processing pathways. Reviews on vitamin D and pain describe possible roles in inflammatory and nociceptive pain, while also warning that the strongest benefit is not universal. It depends heavily on the person, the baseline vitamin D level, and the type of pain. So listen carefully. Do not ask, does vitamin D cure neck pain? Ask a better question. Is this neck pain partly being maintained by low vitamin D biology? That question is more medically useful, more practical, and much safer. First, understand the muscle story. Place your fingers gently on the sides of your neck. Feel the sternocleidomastoid, the upper trapezius, the small stabilizers working underneath. These muscles do not get to rest much. They stabilize the head during typing, driving, scrolling, lifting, and even emotional tension. If these muscles fatigue too quickly, the cervical joints receive more load, the fascia becomes more sensitive, and movement becomes guarded. Now ask, how can low vitamin D worsen that picture? Vitamin D receptors and vitamin D-related enzymes have been identified in skeletal muscle, and research has linked vitamin D to muscle regeneration, mitochondrial function, and the balance between muscle repair and breakdown. In plain language, if the muscle cell cannot manage energy and repair properly, it may become weaker, more irritable, and slower to recover after strain. So give this command to the body: restore the missing support before demanding performance. If someone has neck pain and also has fatigue, muscle cramps, proximal weakness, diffuse aches, or poor response to therapy, check vitamin D status. Do not keep stretching a biologically undersupported muscle and then blame the patient when progress is slow. Second, understand the bone and mineral story. The cervical spine is not only muscles and discs, it is bone, joints, ligaments, and nerve channels. Vitamin D helps the intestine absorb calcium and supports mineral balance. When vitamin D is low, the body may compensate by increasing parathyroid hormone. Why? Because the blood must protect calcium levels for nerve and heart function. How does the body do that? It can pull calcium from bone when necessary. That process can contribute to bone discomfort, reduce skeletal resilience, and a background state where the musculoskeletal system feels more vulnerable. Secondary hyperparathyroidism is commonly associated with vitamin D deficiency, and bone pain can occur in more advanced states. Now bring this back to the neck. If the cervical spine already has degenerative changes, poor posture load, or previous injury, low vitamin D may not be the original cause, but it can be one more quiet pressure on the system. It may make recovery less smooth, muscle support less dependable, and pain more persistent. Ask the patient, Or ask yourself, is this pain purely mechanical, or is the terrain unhealthy? Mechanical load matters, but the terrain matters too. Third, understand the pain sensitivity story. Pain is not just tissue damage. Pain is also signaling. It is immune cells, inflammatory messengers, nerve endings, spinal processing, and brain interpretation. Vitamin D has been studied for anti-inflammatory effects, including reduction of pro-inflammatory cytokine activity and modulation of immune responses. Reviews discussing vitamin D in pain management propose that its most plausible pain-related role may involve inflammatory pain regulation, not simple numbing. So ask, how does that help neck pain? If neck pain is maintained by irritated muscles, sensitized fascia, inflamed joints, or heightened nerve responsiveness, then correcting deficiency may reduce one source of biological noise. It may not shut pain off like an anesthetic, it may lower the volume. Use this phrase, turn down the irritability, then train the system. Vitamin D alone is not the full treatment plan. Combine it with movement, ergonomic correction, strengthening, sleep improvement, and medical evaluation when symptoms demand it. Fourth, look at the evidence honestly. Do not exaggerate. Do not promise. Evidence in chronic pain is mixed. A Cochrane review of randomized double-blind trials found that vitamin D has been studied in chronic painful conditions, but results across trials were not consistently strong enough to support vitamin D as a universal pain treatment. But do not dismiss it either. A 2024 systematic review of adults with chronic musculoskeletal pain found heterogeneous evidence, yet it noted an inverse relationship between vitamin D levels and pain intensity in some findings, suggesting that people with lower vitamin D may experience greater pain severity. Now ask the key clinical question, who is most likely to benefit? Not the person with normal vitamin D who expects a supplement to erase a herniated disc. Not the person with severe neurological signs who needs urgent evaluation. The best candidate is the person with deficiency or insufficiency, musculoskeletal aching, muscle tenderness, fatigue, poor recovery, limited sun exposure, darker skin, older age, obesity, malabsorption risk, certain medications, or persistent neck and shoulder pain that does not match imaging findings perfectly. One randomized trial in people with non-specific musculoskeletal pain found a small positive effect after high-dose vitamin D supplementation, and the study included pain areas such as the neck and shoulders. That does not mean every neck pain patient improves. It means there is a biologically plausible subgroup worth identifying. Fifth, connect vitamin D with cervical spine rehabilitation. Here is a point many people miss. Pain relief is not the only outcome that matters. Balance, posture control, muscle coordination, and confidence in movement matter too. A double-blind randomized controlled trial in patients after anterior cervical interbody fusion used 3,200 IU of vitamin D3 daily for 5 weeks and found improvements related to postural stability and fall risk measures when vitamin D was combined with rehabilitation. Why is that important? Because the neck talks to balance systems. Cervical muscles contain sensory receptors that help the brain know where the head is in space. If neck muscles are weak, painful, or poorly coordinated, the body may move more cautiously. Vitamin D support, when indicated, may help create a better internal environment for rehab, not as a replacement for therapy, but as a partner to it. Give this instruction: do not supplement and sit still. Supplement, then move intelligently. Restore vitamin D if low, then strengthen deep neck flexors. Train scapular control. Open the thoracic spine. Improve screen height. Breathe through the ribs instead of gripping the neck. Walk outside when safe. Build capacity gradually. Sixth, use vitamin D correctly. Ask, how should someone approach this without guessing? Start with measurement when clinically appropriate. The blood test usually used is serum 25-hydroxyvitamin D. Many medical references consider around 20 nanograms/ml or 50 nmol/L adequate for bone health in most people, although thresholds vary by organisation and clinical context. Do not chase extreme numbers. More is not always better. The adult tolerable upper intake level commonly cited is 4,000 IU per day unless a clinician prescribes otherwise for deficiency treatment. Too much vitamin D can raise calcium excessively and may cause kidney stones, bone pain, gastrointestinal symptoms, confusion, or kidney problems. Follow this command: test, correct, monitor, and integrate. If levels are low, a clinician may recommend a repletion plan and then a maintenance dose. The 2024 Endocrine Society guidance emphasizes recommended daily intake for generally healthy adults under 75 and favors daily lower dose vitamin D rather than intermittent high dose strategies in many adults who need supplementation. Seventh, know when neck pain is not a vitamin D conversation. If neck pain comes with progressive arm weakness, loss of hand coordination, gait trouble, fever, unexplained weight loss, cancer history, major trauma, severe night pain, bowel or bladder changes, or electric shock sensations down the spine, do not wait for a supplement to work. Seek medical evaluation, command the situation properly, rule out danger first, correct deficiencies second, rebuild function third. Now ask, what does a practical plan look like? This is the heart of the message. Vitamin D can be beneficial for neck pain when it corrects a deficiency that is feeding muscle weakness, bone stress, inflammatory sensitivity, or poor recovery. It is not a painkiller. It is not a structural repair tool. It is a biological support that may allow the rest of the treatment plan to work better. So remember this, neck pain may begin in the cervical spine, but it often survives because the whole system is under-supported. Ask better questions. Why is this neck still painful? How is the muscle recovering? How is the bone metabolism? How sensitive is the nervous system? How strong is the rehabilitation response? Then act with precision. Do not guess blindly. Do not megadose casually. Do not ignore red flags. Test when appropriate. Correct deficiency. Move better. Strengthen gradually. Recheck progress. Vitamin D helps not because it is dramatic, but because it may restore missing biological permission for the neck to heal, stabilize, and tolerate life again. Take care of your neck, take care of your whole system, and take care of each other. We are learning this together like a family committed to better health. See you in the next topic.